Are you starting or adapting a gerontology or geriatrics pathway, or even searching for content to build courses? Well, today we're going to share some tools and materials offered by Realityworks that can hopefully save you time and jumpstart your pathway development. So here's just a brief outline of what we'll be covering today in the next 30 minutes or so. We know that schools across the country are starting new certified nursing assistant courses, and even more specifically, those relating to gerontology. So during this webinar, we will walk participants through key concepts needed in those courses and show you how you can align tools and curricula that Realityworks offers to help jumpstart your course development. We're calling this session Creating an Engaging Pathway because we're hoping that the information shared will help create a more interactive and experiential program of study for you. So just who is Realityworks? I'll just give you a little bit of background information if you're not familiar with us. We are a simulation technology company that's been around for over 25 years. We started with the creation of our RealCare baby infant simulator, and now we have diversified into many other CTE career clusters and pathways. In fact, today we're in nearly 70% of school districts in the US, but even more fun, we're in over 90 countries internationally. And we always strive to partner with educators and educational leaders to build the types of tools that you will find that you can use in your classrooms that will be useful and relevant to both you and your students. So our products are developed with that hands-on learning in mind. From RealCare Baby through our new welding, our egg and health science programs, we help teachers create those lasting educational and experiential learning tools. So today we'll be discussing just a few of our products, including the curricula, which is key, and again, how these can be used to help build out an engaging gerontology plan of study. When you begin to build your gerontology pathway, there are many places you can start and resources to go to. So let's take a look at the pathways that pertain to the health science career cluster first. The 5 pathways within the health science career cluster are, of course, biotechnology, research and development, diagnostic services, supportive services, health informatics, and therapeutic services. So as you begin to think about your gerontology program, think about what specific pathway courses you wish to include. Do you want to keep it more general, or do you wish to be more specific within the pathway that you're developing? Of the 5 pathways, which ones more specifically are aligned to gerontology? Well, in therapeutic services, we see occupations like CNAs and home health aides. In diagnostics, we see things like geriatricians. In informatics, we see patient advocates, and in support services, health advocates. So any of these occupations could work heavily with geriatric patients. So it could really be argued that any healthcare provider certainly works with geriatric patients. We have highlighted just a few that are more specifically focused on this population. As you begin to look at what you need in this area, a very helpful website to go to is careertech.org/career/clusters. And at that location, you will actually find a plan of study worksheet that is editable. Now here's a sample plan on the screen in front of you that's a plan of study for health science. Now this is a planning tool that helps you lay out the courses you'll need in your gerontology pathway plan of study. So we'll share some resources that can help you build this plan out, but let's first consider what it takes to make an effective health science pathway program. And here are the 6 key elements for developing career pathways. These elements are important to consider, of course, for any pathway program you develop, including any within health science. So as we go through the rest of this webinar, we'd like to think about these 6 key elements and consider how can you use these to guide development of any health science career pathway. And of course, that includes your geriatric one. Again, one very helpful place to go to is cte.careertech.org and the Common Career Technical Course Standards for Health Science. Now, these include specific measurable performance objectives for the health science career cluster in general, as well as each pathway within the cluster. So you could review the standards that apply to the pathway you're developing to ensure that you're teaching those basic core competencies in your program. Now, this, of course, is part of those 6 key elements where you are designing the education and training programs. Again, the URL that you see on the screen in front of you is a great resource to become familiar with also because it includes knowledge and skill statements for the health science career cluster as well as each pathway. So there are these knowledge and skill statements for the health science career cluster, and Each specific pathway, including therapeutic, diagnostic, informatics, support services, and biotechnology, has their own knowledge and skills identified that students should know, as well as an editable template that will help you develop the courses for your plan of study. So here's just one example of those knowledge and skill statements specific to that therapeutic services career pathway. So you can see it focuses on effective communication. So as you're building out your therapeutic services gerontology plan of study, do your courses include this type of content? Are you teaching patient communication skills in your courses? Later in the webinar, you'll see how we can help you do just that and more with our content and hands-on resources. So involving local healthcare industry leaders and clinical professionals in your pathway development is really critical. I mean, how can you understand what local employers are looking for in a gerontology healthcare professional if you don't ask? So consider putting together a healthcare advisory council. So you could choose from a variety of settings and levels of responsibility to get a variety of viewpoints and input. You could bring in a nursing home administrator, a certified nursing assistant, perhaps a home health aide, a geriatrician, a health advocate, or others who work specifically with that geriatric population. You know, you could set up a regular meeting schedule, perhaps quarterly, but have very frank discussions and dialogue asking, what are you looking for in your employees? And then consider on your own part, does your course content align with what they are asking for? You can also be using your advisory council members to form partnerships. Are they willing to allow students at their location for field or job experience or even job shadowing? Are they also interested in coming in to be a guest speaker in your classes? So engaging employers is one of those 6 key elements for developing career pathways as seen on that earlier slide. Now, many districts require that any career pathway created lead to some type of industry recognized certification or credential of some sort. So in order to find the right certification or credentials, be asking some of the questions you see up on the screen in front of you. One of the closest related certifications for geriatric related careers, of course, is certified nursing assistants, because many of these go right into working with the geriatric patient or residents in nursing homes or assisted living facilities. But what about anything more specific to geriatrics or gerontology? That might require some local or state level research on your part, but be thinking about seeing if there's anything more specific you can go after other than CNA. Think back to those 6 key elements for developing career pathways. Certifications and credentials are part of that step that's aligning policies and programs. So we did some research, and here are a few examples of certificates, credentials, or certifications specific to gerontology and geriatrics that we found. Now, the Academy of Gerontology and Higher Ed Programs of Merit has a designation that gives gerontology and health professional programs a stamp of excellence that they can use to verify program quality. They can also lobby within their institutions for additional resources to maintain that quality. They can use it to market the program and recruit prospective students. So this group currently lists 12 institutions around the country that have programs that meet that criteria. And these are both degree and non-degree granting. So one of these is the Fred Manning Certificate of Gerontology, which is online. It includes these 6 courses. So that's just one example. There's another group called Ed2Go that has a certificate program in gerontology that is instructor-led, but it also has a version that is self-paced. You can choose. And some of the coursework that goes into that are Introduction to Gerontology, Physiology of Aging, Mental Health and Aging, Healthy Aging, and Pain Assessment Management in the Older Adult. So these are just 2 examples of the type of certifications you can find specific to gerontology or geriatrics. Now, there are also a few other national organizations to look to. First, the ANCC offers different types of gerontological certifications. Now, these are more for RNs or advanced practice nurses, but we like to point them out. Geriatric or gerontology certificates that one can earn at the high school or community college level are definitely harder to find than your just CNA. Now, NACD has many different categories of related certifications, but here are the ones that we found most closely aligning to gerontology. They have one for home health aide, nursing assisting as well. Another national organization is the American Medical Certification Association that has many certifications available in categories, different categories. The clinical certification area includes things like nursing assistant. The National Health Career Association, the NHA, currently offers certifications with the patient care technician or assistant, which is most closely associated to geriatrics. So you can see there are several industry recognized certifications and credentials that you could consider for your pathway program. Now, here are a few others. The National Consortium for Health Science Education offers a health science assessment. Now, it's not a right-to-work credential, but the assessment does add credibility of a national certification of achievement. It will satisfy Perkins requirements for technical attainment, and it will validate student mastery of foundational healthcare knowledge and skills. Now, some of the benefits for students of this one are that at the end, they get a recognized end of pathway certificate, and it validates the skills that they've attained. It's a certificate for job interviews and resumes, of course, and you can also have your students use it for recognition on college applications. It also may make it easier to articulate into other college programs. Now, HOSA is great because they sponsor dozens of knowledge and skills competitions at both the state and the national level relating to a wide variety of health science topics. In fact, there are 56 competitive events that are aligned to the National Healthcare Foundation accountability criteria outlined by the National Consortium of Health Science Education. So we really urge HOSA members to take full advantage of those HOSA national competitive events because they're a way that they can increase their knowledge and skills as they prepare for those future health occupations. Some of these even relate to the care of aging, including home health aid, personal care, and nursing assistant events. For those interested in working with geriatric patients as a care provider, there's a specific occupation called a geriatric nursing assistant. Now, what are they? Well, most geriatric nursing assistants, of course, work in nursing homes or long-term care facilities under the supervision of registered nurses and other healthcare professionals. Now, they assist patients with daily care and hygiene, meals, and other routine tasks. Some employers require geriatric nursing assistants to earn a CNA certificate or designation first. The type of education you'll need kind of depends on the state and the type of facility where you plan to work. According to the U.S. Bureau of Labor Statistics, if you want to work at a nursing facility, you'll need to complete an accredited CNA program and fulfill all state requirements to obtain certification. Now, some hospitals and health care facilities could also require you to be a CNA, so you have to make sure you're checking with prospective employers to verify necessary academic or certification requirements in your state. So to participate in, if your students are able to, we highly encourage them to participate in health or high school programs like HOSA. If they find and complete an academic nursing assistant or geriatric aid training program through a college or vocational school, that is also very helpful. Now, these are very typically short-term certificate programs that require less than a year of study. Courses common to these programs include human anatomy, nutrition, and something on physiology. And completing these courses can help you prepare for certification exams, of course. You could also receive on-the-job training at a hospital or a long-term facility as well. To become a CNA, you'll need to pass a competency exam and complete at least 75 hours of training from a state-approved program. The National Council of State Boards of Nursing offers a list of state-approved training programs at their website, but in some states, you may be able to earn additional certification as certified medication assistant in order to administer medication to patients. So lots to consider, lots of different ways that your students can go about getting into a geriatric occupation. So if you're interested in creating a unique gerontology program of study at your school, think about the content that you want to provide. Curriculum forms the content backbone to any effective plan of study. What you teach is just as important as how you teach it. So think back to those 6 key elements. That's where we can help you. We can help you design your gerontology program or plan of study and the courses and the content that you'll need to include. You know, we literally have dozens of lessons from a variety of curricula provided with our experiential learning resources. So we've reviewed them and we've put together a recommended package of content for creating this geriatric pathway. So here's a list of the content that's available with the Realityworks products that we're recommending for use in a geriatrics program and plan of study. And each of these integrates teaching soft skills, things like patient empathy and communication, along with specific geriatric nursing care skills. So on the screen in front of you, you see 8 to 10 different curricula that we have that are available, that come with the geriatric resources that we're going to talk about a little bit later on in our webinar today. But when you look just at the content, you can see that if you're starting from the ground zero, this can really help you jumpstart building the content. We provide all of this for you. So again, once you see the breadth of content that's available, The next step is to figure out how to plug it into the courses that you have in your plan of study. So remember the earlier slide that had the list of courses in that template? Well, you may already have some of these experiential resources, and if you do, you can begin to review the curriculum topics included and see where they best fit in the pathway. Don't reinvent the wheel. The lessons that we have with our materials are created by educators and for educators. In them, there are step-by-step instructions and assessments, slide presentations, and ready-to-use activities that integrate the use of all of the resources, simulators, task trainers, right in the lesson plan. So we've tried to make it very, very user-friendly for you. So Realityworks also has a standalone employability skill program that teaches 20 different soft skills. Now the program that we have can be used in any career pathway program. So each lesson is a standalone on a specific soft skill. You could teach them all, or you could pick and choose those that you really wanted to focus on for your geriatric pathway. So the program comes with instructor guide, student workbooks, and scenario cards. So if you'd like to significantly increase your soft skill instruction, here's a very easy way to integrate it into your health science plan of study, specifically the one on gerontology. So now that we've looked at some of the content available, we're going to share some of the hands-on resources we have available and that we specifically recommend for a geriatrics or gerontology pathway and plan of study. These are the recommended simulators and task trainers we have that provide students with that practical application of the content that you've learned. Here's where you get that hands-on learning of transferable career skills and foundational knowledge that you can use in a geriatric-related career. For example, the geriatric simulator. It's a wearable suit that helps your students walk in the shoes of an aging patient. Nothing will get them to understand and have empathy sooner or quicker than when they put that on and they actually have to do physical tasks, all while experiencing common conditions of aging. The Geriatric Sensory Impairment Kit, again, has students walking in the shoes of geriatric patients that have hearing loss or hearing impairment of any sort. They have the tremor simulator. There's also arthritis simulator. And again, we have students put these things on. These are all wearable experiences, so they get an understanding of what it's like for their patients to have these on a daily basis. The geriatric nursing mannequin is very, very helpful. It teaches over 15 different, those hard nursing skills that your students have to know, especially for taking care of patients in like a nursing home setting, that kind of thing. We have a geriatric skin condition kit, 9 different common skin conditions or things that happen to geriatric patients that, and these wounds can be put on mannequins or on real people. You can do identification and assessment. You can chart them and treat them. Same thing with the pressure injury kit. We have 4 stages of pressure injuries, 1 through 4. Again, things that can be put on mannequins or people for different medical scenarios. Our geriatric medication management simulation kit's a brand new program that puts your students in the shoes of a patient that has to manage 6 different medications while having cataracts and tactile sensation that's dulled. We have them try to read the labels, take the pills out of the pill bottle. They have to identify the correct dosage, any contraindications, and they quickly learn through that simulation experience how quickly things can go awry for geriatric patients having to manage multiple medications. The hemiplegia simulator puts you in the shoes of someone with a stroke on one side. Then, of course, we do have a few DVDs that help give foundational information on communicating with your aged care residents, as well as home health aid tips. So once you see the variety of these hands-on resources that are available, you can begin, again, to plug these into your plan of study. Which courses would you use these different types of simulators or task trainers in? And once you make those connections, you'll see how using these types of hands-on learning tools can make content memorable and make the learning sticky for your students. It will help them remember everything that they've learned. So it's a lot of information to digest in a relatively short time here. So what should you do first? Well, we can help. We've created a very, very easy way to develop a gerontology pathway to provide both content and hands-on resources that are ready to literally be used immediately. So the suggested resources and hours of content fit within that health science career cluster. So we could help you build 20 hours of content and all of the interactivity that you would want to see in a pathway of that sort. So to learn more about this type of a pathway package for gerontology, you can actually go out to our website at the link provided on the screen in front of you and take a closer look. Or if it's more to your liking, you can certainly call us or you can email us at information@realityworks.com, but reach out to us and we would be happy to talk about how we could build a gerontology or geriatric pathway package that is customized to your specific needs. But again, we do have the package that exists. That's one SKU. It's a total solution that you can purchase and get it all at one time. So here's just a great visual from the National Consortium of Health Science Education that summarizes how the Health Science Career Cluster leads to filling the skills gap that we have in health occupations. It begins with awareness in the early grades, gradually progressing to foundational knowledge and skills through high school, leading to specialized knowledge and skills in the 5 pathways learned through post-secondary coursework and in the workplace. So 2 or 3 of the newer products that we want to point out that are now available in the last, I'd say, couple months are our hemiplegia simulator, the one that I mentioned where it's a wearable where you experience stroke on one side. We have that geriatric medication management simulation kit that you can literally pair students up and 24 students can go through that simulation experience at the same time. And then, of course, we have a new set of geriatric employability scenario cards that have been created by a subject matter expert. And what that is, it kind of goes along with our employability skills program. Each of the cards features a true-to-life geriatric workplace workplace scenario. And each card focuses on one specific soft skill that's weaved into that scenario. You can use this for small groups, you can use it for a whole class activity, but you read through that scenario, that geriatric scenario, and then there are key points of view to consider, but also there are some key discussion questions. And it's just a really engaging way to get your class of students focusing on some scenarios that they will run into in real life if they work with geriatric patients. So we like to point out those new exciting things to keep your eye out for. So at this time, we would love to open it up for any questions that anybody might have on any of the content that we've covered today. And Katie, do you see any questions yet? Right now, I don't see any questions, which that's good too. Sometimes questions come after the fact. So if you have any questions regarding anything we covered today, again, reach out to our 800 number or go out to our website and even email us. We would be happy to follow up. Thank you for sharing the last half hour with me today. We really appreciate all of your time and attention. And
one question. Do you have any PTA programs currently using these products?
PTA meaning Parent Teacher Association. I'm not quite sure. Let's see.
Oh,
physical therapist.
Yeah.
I don't know about physical therapists, but I have personally met with a post-secondary institution for their occupational therapy program that are using some of the geriatric wearables in their program. Oh, okay. I see that the question came from someone from a physical therapy background. So I think that certainly many of the products could have a very good fit in a program like that. If you go out to our website, we actually have more information by each product. We have a product page, and on the product page, we feature short videos that show many of the products in action and give you more information about the use and some of the curricular topics in it. So if there are some very specific products that you think would be very useful in your program, that's another very helpful place. You can go to realityworks.com and go out to specific product pages, and I think that you'll find a lot more information than we can provide just in our webinar today. So.
And then Julie had a question. We have some curriculum in place already. Can we purchase items separately?
Yes, absolutely. We offer that pathway package as a kind of a one-stop solution. However, if you already have some of the items, all of the individual items in that pathway package may be ordered a la carte. Most, if not all of them, are available even on our website store for purchase. So yes, and anything that you order separately, the curriculum does come along with it as part of the whole package or product. All right, well, thank you again for spending the time with us, and good luck as you build out your gerontology or geriatric pathway programs. Thank you very much.